Good morning, ladies and gentlemen. Welcome to the first day and the first session of the 58th Annual Academic Sessions of the Ceylon College of Physicians. This is the first plenary, and here with me, the co-chair is Professor George Dalekos. He's the president of the European Federation of Internal Medicine, and he will speak our speaker in the morning.
Okay, good morning from me also. The first plenary session will be given by Professor Mumtaz Patel, who is the president of the Royal College of Physicians London, consultant nephrologist at Manchester University Hospitals NHS Foundation Trust, and honorary clinical professor at the University of Liverpool. She has served as RCP Senior Censor, Vice President for Education and Training, and Global Vice President, leading initiatives in education strategy, global engagement, and women's leadership. She has also held senior NHS and university roles, combining clinical expertise with medical education and leadership, and she will give the talk entitled Physicians for the Future, UK and Global Perspectives. Dear Mumtaz.
Thank you so much for the kind introduction, and good morning to you all. Good to see you in the hall after the late finish yesterday, and thank you so much for attending. So in line with the theme of the conference, I thought I'll give an overview around physicians for the future and give some both UK and global perspectives. I've got half an hour and I've got my timer running in the background, so I'll hope to keep to time and speak for about 25 minutes or so. So firstly, I've not got any declarations to declare. And my learning objectives for this session would be that I hope that by the end of this session, you'll be able to understand some of the concepts around physicians for the future, giving some UK and global perspectives, acknowledge the key characteristics of what a physician for the future should encompass, appreciating the change and the nature of the medical education and what the needs are now of education and training. And then give an overview of where training is now and what the future trends are for education and training to develop the physicians for the future. And also just give you an overview of some of the Royal College of Physicians work around prevention, health inequalities, and developing the next generations of physicians campaign. So starting off with a quote. So this is a quote from Dr. D.C. Jarvis, who's an American physician born in 1881, and I thought it was still quite pertinent for today. And he says that he believes the doctor of the future will be a teacher as well as a physician, and his real job will be to teach people how to be healthy. So this is really pertinent given where we are now, because I would hope that many of us around the table and here are all medical educators, and we're here because we're invested in our physicians of the future. And also gives the emphasis around prevention, because prevention and keeping people away from hospital and the clinic's room is what we're trying to achieve. So this was, I think it was published in 2013, but I think the actual quote was from the 50s and probably still pertinent today. So thinking about key concepts and definitions. So the Physicians for the Future per se is more of a vision about being adaptive, patient-centered, technologically integrated, medical professional, emphasizing that lifelong learning, the interdisciplinary collaboration, a lot of things that we probably do already today, and then embracing innovation rather than within a single entity. And it's leveraging tools. We talked quite a bit yesterday about artificial intelligence, telemedicine, and personalized care, and more holistic care, which is what we aim to achieve in what we do day to day. And that focus on prevention and that wider understanding of patient ill health, as well as the wider well-being, and working alongside our wider healthcare professionals to improve broader healthcare landscape and system. So, things that we probably already do, but encompassing some of the broader concepts and some of the newer concepts as well. And when I did a good old Google search on physician of the future and images, this is one of the things that came up. So this is from the Canadian Medical Education Journal, 2023. And what should, how would the physician of the future look like? So they say, a young female, which is good for women empowerment, for something that I'm very much of a champion of ambiguous race. So, valuing diversity, somebody who's on the smartphone, because I don't think any of us can live without a smartphone these days. Certainly my children can't. And that growing impact of technology in medicine. And then a global map behind, showcasing the globalization of medicine, and then the clouds representing the uncertainty of the future. So that was quite interesting as a concept and something to start the discussion with this morning. So the key characteristics around the physician of the future, different things are encompassed here. There's loads of talks on AI during the conference, so I'm not planning to replicate any of those today, but just give you some core principles. So someone who's technologically proficient. I think some of us in our generation are more inept in trying to be more proficient, but certainly something that we really need to embrace. Technology as, more and more is needed in medicine. So whether it's artificial intelligence to enhance diagnostics, personalized treatment, and deliver care remotely. And we learned a lot of that through COVID years as well. And being more holistic and community orientated as well, with that focus on public health, the social and the wider determinants of health, and beyond just organ systems as well. And precision-focused medicine, I know there's quite a few talks on that as well during the conference time. And then that wider being collaborative and flexible, which I'd hope, again, we do day to day, but I guess more to do and using our interdisciplinary professions in a much more sort of streamlined way. And then that shifting focus of practice where we need fewer diagnostic experts because some of that work may be or is likely to decrease with the role of AI and having some automated tools. But the level of complexity, I think the role of the physician will always be there, and interpretation as well as the wider sort of landscape. I think the role of physicians, which I'll go on to later, will always be there. An enhanced need for general practitioners, but also thinking about the prevention agenda, thinking about, keeping people away from hospitals, providing that holistic care more in the community as well. And then that need for specialized technical skills, particularly for the skill-based physicianly specialties, but also surgical specialties as well. And of course, to enable this, we need to think about how we train, how we educate our future generations as well. And as you can see, communication skills always comes right at the top. I think without good communication, you could be the most technologically proficient or capable doctor, but if you can't communicate, then, I think we're not doing very well day to day with our patient care. So strong communication skills will always be needed. Adaptability with that lifelong learning and continuously assessing again, which is what we do in our physicianly careers. And then that kind of focus on public health and communications as well, which I think, again, with the prevention agenda is important. And then what are the global implications as well? So climate health is a real emergency, as we all know, and the future physician will have even more of a need to understand the climate health emergencies as well as the challenges, and again, how that impacts on medical practice day to day, as well as wider patient populations. And the globalization and the diversity, even in the UK, we're of such, wide diversity in how we embrace that, how we support our patient populations, both with the public health needs, but also the wider determinants, and what we see day to day as well. So that the impact of challenges of globalization will become greater and greater with time, and that needs to be factored in. And then the changing nature of the medical workforce. So where are we now? So this is the data from our GMC, the General Medical Council, who produce the State of Medical Education report annually. And for the first time in 2024, there were more doctors of an ethnic minority on the GMC register. So it's funny, isn't it? Ethnic minority, but we're not a minority. Over 50% on the register are a majority of ethnic minority backgrounds. And 2/3 joining the NHS were of non-UK backgrounds, a lot of locally employed doctors. So we have the traditional training pathways and we have the non-traditional training pathways, where that's been a growing workforce over the years. And there's again more women within the NHS workforce, so up to about half, 49% now. But there's still a disparity in the senior leadership positions, which is something that I'm very much focused on in my work in empowering women and inspiring women and supporting women into the senior leadership positions with our RCP Global Women Leaders Program. And it took 500 plus years for the college to have somebody of an ethnic minority background and female as a president. So we've got lots of work to do. And when you look at the trends of the increase in the international medical graduates, again, the highest rate is from South Asia, then Middle East, North Africa, and then from the other parts of the world. And when you think about that, equity and inclusion becomes even more important as a reality and something that is a great priority, both in the UK, but also in the wider medical workforce to embrace and to support and to integrate as well. So the GMC Good Medical Practice Guidance changed in 2024, and some of the key updates are shown here. And the 5 key areas to help and support on the left-hand side around being respectful, fair, and compassionate working places. So we all know that the working environment makes a huge difference to training. And that's something that we want to support, promote with inclusive, supportive leadership as well. And promoting more patient care, centered care, which we always do, tackling discrimination fair on, and championing fair and inclusive, supportive cultures. And the updated standards on the right-hand side reflect that as well. So you've got your knowledge, skills, and as it was behaviors, but that's now changed to development. The patient and the partnership, the patient-public partnership with clinicians is so important, and that focus on communication, culture, trust, and professionalism. So again, that kind of goes quite nicely hand in hand with the development of the future physician. And of course, we need to change the way we train to accommodate for the development of the future physicians. So there's already been a number of changes in medical education over the last few decades. I trained in Manchester, and a lot of my teaching and training was in big lecture theatres with 300 plus people. But we've moved away from didactic learning to more problem-based learning, from more case-based learning, and that emphasis on integrated learning, competency-based needs. And assessment methods have also changed to reflect that, from traditional exams and things and very much rote learning to now more OSCEs, workplace-based assessments, and entrustment professional activities. And that focus on professionalism, wider generic professional capabilities, which is really important. And the impact of the educational environment is key on learning and assessment, and also that importance on student and trainee well-being and support. Even in Manchester and my medical schools that I support, up to 1/3 of our students will require wellbeing support. It was very much unrecognized. It was probably the need was always there, but certainly the need as well as the support and what needs to be provided provision-wise from undergraduate and postgraduate training has significantly increased over recent years. RCP produced this report back in 2018, which is still quite pertinent. And Professor Elder yesterday, in his opening speech, talked about the role of the doctor. What is the role of the doctor? And then we will be able to determine how we train, how we support the future physicians. So the doctors were always seen as the healer. My grandfather was a doctor in India as a medical officer, and he was always seen as the healer, the supporter, making people better. But very much the relationship of the patients and public with the physicians has changed. It's much more of a partnership now, seen as a team worker, but also as an educator, a researcher, a manager. as an innovator. So the roles are so diverse now of what we do. And given the shifting context of what we're dealing with aging populations, with complexity, with advancing technology, the role of the doctor over the decades, but certainly more so over the last 10 years or so, has significantly changed. And if the remit of a doctor changes, then therefore we need to change how we educate, how we train, and how we support our doctors as well. So when we think about the goals of modern medical education, these still sort of remain. So standardizing learning outcomes. This is where sometimes we go wrong when there's not standardization and, things are not met with learning outcomes. And then that wider emphasis that it's not about just clinical learning, it's wider research, policy, education, and now technology, reflecting that broader role of physicians as well. And in practice, you need to integrate all these aspects in a way that's much more streamlined. Again, in my years of training, it was very preclinical, clinical, very distant from patient sort of learning. But that, better integration into kind of the spiral way of doing things needs to be there, but also involving and thinking along systems rather than just beyond patient care as well. And the GMC, again, are regulated with the generic professional capabilities. We think about these interdependent, essential capabilities that underpin a doctor's role. And I think many of these things have not changed, and these are in our current curricula, but probably more needs to be developed to encompass the future positions. So you've got your knowledge, skills, and behaviors, which are absolutely key, but then you've got that wider focus on health promotion, illness prevention, leadership, team working. We did our leadership workshops yesterday, and I think instilling leadership skills early is absolutely key in our future physicians as well. And wider education and training, research and scholarship. So all these things to encompass within our teaching and training. And that shift in emphasis. So we've gone from informative learning that produces expertise with very much knowledge and skills and a lot of probably rote learning from years gone by, to much more formative learning, which produces professionals, and then that transformative learning producing enlightening change. And that, I guess that's where we want to be going, in that direction over time. Of course, COVID has had a negative impact, significant negative impact, more so around these things, uncertainty around progression, teaching, training, and then things change with regards how we taught, how we learnt as well. And that impact of training has been seen wider, both in trainees, but also in trainers. And I think this still continues. And I guess that degree of moral injury needs to be recognized. And again, how we support each other with compassion, with empathy within our teams is really important as well. So when you think about the current challenges in medical education, we always have this service versus training everywhere globally. And I think how we prioritize training along with service delivery, maximizing the digital solutions and embracing digital technology rather than being scared of it, and that attention to well-being from a trainee and trainer perspective as well. There's lots of gaps in trainee rotations in the UK. Recruitment and retention are huge issues, both in the UK but globally. And burnout is a huge issue as well. So we need to think about how we nurture our next generation of physicians as well. And some of the trends are shown here. We've got expansion in medical school places, but we need to commensurate the same level of increases in foundation core specialty training. We've got hybrid learning. We need more integrated medical training, and mental health of both trainees and patients will become and is already more of a focus as well. So again, adapting the way we teach and train is important. There's a number of new targets on race equality and equity, which I've mentioned as well. So again, in the UK, a big focus around eliminating racial discrimination and disadvantage and unfairness in education as well. And a lot of this work is around creating fair, inclusive, compassionate and supporting environments as well. And what works in this space? So we know I've been in this research theme area for the last 10 years, and things which have been shown to work are around mentoring, peer support, earlier identification of learning needs, and then that personalized, targeted support as well, and improving the quality of feedback, very key principles in medical education. And then wider exam support And we need to train our trainers better so they can better support our learners as well. And the changing perception and the shift moving away from a deficit model. So I've done a lot of work of supporting our international medical graduates and moving away to say everybody is more than capable, but we know that the educational environment is absolutely key in progression. So how can we as educators better support our learners? And I think that's the shift that we want to see more so with time. And I've led a lot of work in secondary care and research in differential attainment, which is trying to make outcomes fairer for all. And this was programmatic cross-specialty research across organizations and formal evaluation of interventions, which showed improvement of training outcomes and educational experiences. And a lot of this was around trainee and trainer interventions, so supporting the trainers with compassionate leadership, kind of workshops and educational faculty development, and then trainee exam support, mentoring, buddying schemes, wider support, and moving away from like that deficit model, which I mentioned. And addressing health inequalities is absolutely key as well. So going back to that prevention agenda, where the future physicians' needs are as well, and that learning from the COVID experience and understanding the social determinants of health, and also awareness of leadership in that kind of system way. So moving beyond just thinking about cardiovascular risk, thinking wider of how can we enable the systems to better improve the prevention agenda. So in the UK this time last year, we had the big Darzi review after the new government, and the 10-year plan was published in summer of this year. And we talk about the three big shifts, moving from healthcare, from hospital to community, from analog to digital, and sickness to prevention. And that's very much aligned with the future physician that we've talked about and what the characteristics and what the needs are from a population basis as well. And then we've talked about a cross-government strategy to influence and achieve health equity, and then the focus around setting up and looking at the key determinants of ill health, because the prevention agenda around the wider determinants that we talked about yesterday, and sometimes as doctors, maybe we've not always appreciated the need of looking at things like employment, air quality, discrimination, wider things, which then impacts on our patients and wider populations. And at the RCP, we set up an Inequalities in Health Alliance in 2021, and this is kind of driven by a number of organizations. And we've campaigned and influenced a number of different things: the reintroduction of tobacco and the vapes bill, restriction on junk food, obesity is a huge issue both in the UK, but I'm sure it's a huge issue in South Asia and other places as well, around alcohol prevention as well, and wider health determinants, to ensure that we can keep people away from hospitals and think about wider prevention strategies as well. And the other big piece of work, which has been quite exciting, so 2025 has been our year at the RCP for our next generation of physicians, and we're putting resident doctors at the heart of everything that we do. And we've led a number of different campaigns, so whether it's around delivery of best possible care, but also reform and radically changing our postgraduate medical training systems, which are certainly currently not fit for purpose and need changing. So it's an oversight group which is predominantly made of our resident doctors, and we're doing a number of different wider issues as well. And this work then influences our national policy processes as well. And we've campaigned, so no point having great NHS plans if we don't have the workforce to support it. So how do we do that? We need to make sure that the right workforce is in the right places and they're supported as well with their teaching and training. So a number of good pieces of work as well. And then wider, how the teaching and learning trends in medical education. So of course, we've been adapting, but more needs to be done of how we teach, how we train, much more interprofessional learning, different ways of teaching. My children don't learn in the way that I do. It's very much on-demand learning, YouTube videos, beyond the kind of textbooks way of learning, and more asynchronous learning rather than the way that perhaps we learned. And again, how we train, the role of AI, simulation, virtual reality, robotics, all these things are changing and need to adapt in order to enable the training of our future physicians as well. And working alongside newer professions, a number of new professions have come through over the last 5 to 7 years, and this is increasing from learning technologists to precision bioinformatics, lots of different things, and again, that needs to be encompassed as well. And assessment trends in medical education have also changed, and again, shows the need for entrustment. So it's gone beyond knowledge, skills, behavior to wider. So how do we entrust those activities, those professional activities in our future generation of doctors as well? And that focus on higher order learning as well. And that's something I don't feel AI can do very easily. So you can possibly look at the lower levels of knowledge, skills, and application, but it's the higher order learning, which is where the human factor comes in, and the training needs to be reflective of that. A lot of our curricula have the capabilities in practice now, the entrustment professional activities, and it's very much how do you, kind of make sure that people are proficient, are capable, are trusted to run things independently, and then the capability framework is learned in that way. So what are the opportunities in the last couple of minutes? So yes, of course, we need flexibility in the way we train our future physicians. We need to improve our training environment, optimize and improve our educational offer. We need to optimize the use of technology. We don't need to be fearful of it. It's how we embrace it, how we adapt that, how we integrate that into both our undergraduate and postgraduate curricula. We need faculty recognition because we all do a lot as medical educators, but again, that recognition and that wider sort of support is needed, and that integration of interprofessional learning and that wider team working as well. So training for physicians for the future, I think that greater focus on personalized learning, importance of the student trainee and the trainer well-being, I think we always forget about ourselves, and that move towards virtual hybrid options, maximizing digital solutions, that focus on interprofessional learning, and developing more portfolio careers. Many of my trainees would say, I want to do what you do now, of a much more portfolio career, and that needs to be enabled so that people can do things in a different way rather than the traditional way. Because we are losing doctors, it's hemorrhaging in the UK, and certainly I'm sure it's similar in other parts of the world as well. And that need for compassionate leadership and supporting each other is so important to keep people nurtured and supported in the healthcare systems. And cultivating, I talk a lot, and yesterday we did our leadership workshops and I talked about cultivating compassionate leadership, and that kind of how we demonstrate empathy, how we support, how we learn, how we listen, and provide that compassionate environments, because it is a stress system that we're working in. And without that wider support, I think we're all going to falter within that system. So it's, again, how we support each other. But not to forget the self-compassion aspect side of things as well. So we're all very good at supporting each other, but sometimes that self-compassion is lost. And as my mum always used to say, unless you look after yourself, you can't look after others. And we need to maximize that in how we learn, how we support, but also more importantly, how we look after ourselves as well. So finally, that question around, will artificial intelligence replace physicians? My humble view is very much that that doctor-patient relationship is built on empathy and trust. And I think the need and that qualities that at a human level that physicians have will never be replicated by AI. Yes, it has its benefits, and I'm sure it will augment what we can do and support our roles. But I think the care as its delivery is being transformed, and there's very much a role of AI within the healthcare delivery settings and the different tools of how we deliver, how we support, how we diagnose and support our patients. And some tasks may become automated, and that's good, and I think we should see it as a positive rather than as a threat. But again, I think the role of physician for patient care will not be lost. And I think that kind of empathy, that support, the hand-holding, all these things that we do so well for our patient care, that will not be lost. And I think that it will always be needed. If so, it will be needed more, because I think that kind of human aspect is very much needed. So I hope in my last minute, I've covered the intended learning objectives that I intended to cover at the start of the talk around the concepts around physicians for the future, some of the characteristics around the changing face of medical education and training, and giving a bit of an overview of how we should teach, train our physicians for the future, and that kind of awareness around health inequalities prevention and some of the RCP work in this space as well. So I hope that was helpful. Thank you so much. And I've just about finished on time. Thank you.
Thank you, Mumtaz, for that excellent lecture, which is really the spot on and in keeping with our the theme, the physician for the future. And let me again invite all of you to show our appreciation to Professor Mumtaz Patel in the usual way.